Hi guys. I just wanted to do a little bit of clarification for CMS, the new place of service 31 and 32. So I just wanted to share a little bit of what I have. Um, Again, as you know, everything that I do that is CMS based, I want to bring to your attention so that you know that this isn't just something that's random, that is actually something that I got off of CMS. So this went into effect July 1st. It talks about the place of service. It's actually got the CMS logo on it. It is actually a CMS regulation. So what is changing and why? So the place of service is where we take why the patient is actually being seen by the facility and we get paid off of that. So there's two different codes that we've been using for quite some time. There is the POS 31, which is this SNF. And so those are for the Medicare patients. And then there's the POS 32, which is the long-term care patients. In the past, we tried to do as best we could, but if we didn't do it correctly, it was just a code that we put on. As of July 7th, when this took place, now they're very, very vigilant. If you are coding a POS 31, place of service 31, and it says SNF, it has to say Medicare Part A coverage at the facility. Now, this doesn't mean that they have Medicare on their face sheet and that they're long-term care and they have Medicare somewhere. What this is saying is that they are at the facility currently under their Medicare Part A stay. So, for example, I pulled the census of some patients, and in regard to HIPAA, there would be no names on here, but this is an average list of different payers: Medicaid pending, Medicaid sunshine. Anything that has Medicare in its name would be a place of service 31 or an SNF code. So that would be here, Medicare. It would be here, Medicare A. It would be here, Medicare A. If you even look down here, it would be Medicare level Blue Cross Blue Shield. So anything with an MCR or an MCA, anything that says the patient is there for a Part A stay is what we would be billing, an SNF or a 3-1. So in our computer systems, and all computer systems are different, ours would say SNF 99310 as a nurse practitioner, or SNF 9931309. So those would be our codes that we would use. Now, any patient that is in the facility that does not have active Medicare A, they might have it on their face sheet, they might have Medicare as a secondary, but they're not on an active Part A stay. And I just bring this over real quick to go back to this person has Medicaid pending, but they might have Medicare on their face sheet. They're going to be a place of service of 32. They're going to be an LTC. Same thing with this Medicaid, long-term care, Medicaid, Medicaid down here, hospice, insurance, anything that does not say Medicare on it is going to be a POS 32 or an LTC. So if you were a nurse practitioner and you were billing out a long-term care patient, or you're billing out a short-term care patient that does not have active Medicare benefits, you would bill out an LTC 99309 or 99310. Now, LCSWs would never see a Medicare A patient, so they would be billing out a 32 or an LTC. So it might say something like LTC 90832, or it might say LTC 90791. If you're a nurse practitioner, it would say LTC 99309. So just to clarify, if it's a 3-1 or it's an SNF, it has to say Medicare on their census line, not on their face sheet, on their census line. And so what happens if you do that incorrectly? Well, if you do it incorrectly in the past, whether they fixed it or not, it wouldn't affect your reimbursement. Now, as of July 7th, if you use a place of service 32 or the LTC, and that patient is on a Medicare A stay, it will either get rejected or they will pay you, and then you have to pay them back. So that money has to be returned. So tips for billing, verify that they're on a Part A stay. And if they're in a SNF, you'll be able to see that based on their census line. Ensure that it's accurate and timely billing. So maybe they're SNF and they're on Medicare for 3 days. Make sure you check that if you're doing another visit, because their pay status, what they're actively being reimbursed for, might change. They might be Medicare A for 10 days and then go to an LTC. They might be under a long-term care stay, even though they're still getting therapy, even though they might be there only short term. If they don't have Medicare in the title of why they're there, then you're going to get a denial. And then coordinate with facility billing staff. If you just have questions and you want to make sure they are on their Medicare stay, just take a peek at that. So again, just to recap real quick, Medicare A, anything, Medicare A, Medicare Advantage, Medicare HMO, it is considered an SNF. And so it would be billed under place of service 31. So your SNF 99309 or your SNF 99310. Any other plan, anything other than Medicare, anything that's a private insurance, that's a Medicaid, that's a VA, that is a Medicaid pending, would be considered a 3-2, and it would be considered an LTC. I hope that helps with that information. Again, the URL is on there, so all you have to do is look that up and you could get the actual information from Medicare. But in the meantime, happy CPT coding, and let me know if there's any questions that I can help you with. Have a great day.